HMIS online training for HMIS 102B, completing a universal entry and exit assessment for households. I'm your trainer, HMIS System Specialist, Shantae Smith. Training will go over how to complete a universal entry assessment for a head of household and an additional family member, as well as exiting those clients. To get started, we are going to enter into Backdate mode, as we are going to pretend to enter in historical data. By doing so, you will click on the Backdate button so that the box may appear. From here, go ahead and click on that blue circle with the arrowhead to clear out the date, and type in the date to which you need to enter data into. For this example, we will go back to January 1st of 2017. From here, go ahead and click Set Backdate. Your banner may or may not turn to a bright yellow to let you know that you are in Backdate mode. We will begin to enter our client into our project. To do so, you will start by going to the Client Point module to search for your client. Our client, Mother HMIS Test, presented to us on January 1st of this year to enter into project. Because she gave us her first and her last name, we do need to complete the name data quality. You have the option of full name reported, partial street name or code name reported, client doesn't know, client refused, and data not collected. Please note, client doesn't know is for when a client does not know the answer to the question. Client refused is when the client refuses to provide you the answer to the question. And data not collected is when you, as the interviewer, did not ask the question. In this case, our client did report their full name, so we will select this. Alias. Alias is an option to use in the event that your client reports to have a second name. Underneath alias is a social security number. Please complete the full social security number if your client reports it to you. If your client reports a partial social security number to you, please list the numbers in the appropriate section. In this case, our client gave us her partial social security number by the last 4 digits. Underneath this is where you will complete the social security number data quality. You will have the option to say whether your client's full social was reported, or was it an approximate or partial social security number. The client doesn't know, client refused, and data not collected. Again, in this case, our client gave us their partial social security number. U.S. military veteran. Please answer this question for any individual over the age of 18. If they are younger than 18, you may skip it and leave it at select. In this case, our client tells us that she is not a veteran. Then you have this button of exact match. Please do not click it. By clicking it, it will only search for what you have typed in exactly. It won't search anything outside of that. Once you're done entering this information, go ahead and click Search. In case we are going to pretend that our client does not exist within the system. You would click on Add New Client with this information. By doing so, you will get a warning box that will ask you, are you sure if you're ready to add this client and create a brand new record? At this point, you will click OK. By clicking OK, we have created our client's HMIS profile. The numbers on the top left-hand side will be your client's HMIS identifier. This will also automatically default to the Summary tab. The next tab you will see is the Client Profile. This client record box can be edited by using the pencil to the left, and you can enter in the information as needed. The picture to the right is in the event that your client signs a photo release form, you are able to take a photo and attach it to their record. The Client Demographics section is where your client demographics will be populated from the assessments that are completed through the EntryExit tab. Please do not edit, add, or delete information from this box. Below that, you will see a section that says AZ Client Nodes. This is where you are able to enter in generic notes for the client. The box where you see client notes is not used in the balance of state. File attachments is where you are able to attach files to your client's record. Maybe this can be a copy of their birth certificate, housing paperwork, or medical paperwork. Below that is another tool that we call incidents, where you are able to document the incidents that occur with your client. By scrolling up, the next tab you will see is the Households tab. This is where you will create the family groupings for your client. If you only serve singles, this video was not for you. And in the event that you are serving a single, you may see a list of names listed here. Next to ROI, households is ROI, the release of information. Please note, a release of information must be listed and documented for every project your client is being served from. The EntryExit tab is where you will enter your client and other household members into your project, update their records, as well as exit them from the project when they are no longer being served. The Case Managers tab is where you're able to add yourself as a case manager. This is further discussed in the Case Management series. The Case Plans tab is where you're able to outline goals and case plans with your clients. Again, further explained in the Case Management series. The Measurements tab is where you will find full SPDATs, FSPDATs. Above Measurements is the Service Transactions. This is where you can document services provided to your client, referrals, view their past shelter stays, as well as their entire service history. Again, this is further discussed in the Case Management series. From here, you can click on Client Information, and we will begin with the Households tab because now we will create our family grouping. Since we are on our Mother HMIS test client, our Mother HMIS test client has also entered into project with her baby test client. We need to create them as a family household. So from here, you would click the button that says Start New Household. You will first provide the household type: couple with no children, an extended family unit, female single parent, foster parents, grandparents and child, male single parent, non-custodial caregivers, other, and two-parent family. In this event, she is a single mother. Now, in the client search box, you will search for the additional household members. We are going to search for our baby HMIS test. Our baby HMIS test did provide us with their full name. The baby does not have an alias and does not yet have a social security number, so we will document that as client doesn't know. Since the baby is younger than 18, we will skip the U.S. military veteran question, as well as skip the box that says exact match. By clicking search, we are searching for our client in the system. In the client results section, there are no matches. This means that the client does not exist within the system. So from here, we will click Add New Client with this information. Once you do, you will have that warning box appear asking if you're sure if you'd like to add the new client, and you will click OK. By doing so, you will see that the baby HMIS test is now listed below with the mother. From here, click Continue. It now takes you to the Household Information tab. This is where you will specify who is the head of household. In this case, the mother is the head of household, so you will change that no to a yes, and then the relationship to head of household changes to self. Next, the baby test client is not the head of household, but the relationship to the head of household is that they are the daughter. From here, you can click Save and Exit, and it will take you to your household screen to show you your household makeup. Next, we will need to complete the ROI. Again, remember, this must be completed for all clients entering your project, whether they have granted permission to share information or have denied it. You will click Add Release of Information. Make sure the names of who this applies to is checkmarked. Your provider would be listed, and then the release is granted in this case, and it is granted for 1 full year. The documentation is a signed statement from the client, and the witness is myself. You can then click Save Release of Information, and it will generate here. And you will also notice that the release of information gives the green, aka go, for the entire year. Next, let's enter them into our project. By doing so, you click on the EntryExit tab and click Add EntryExit. From here, you will check mark the names of the individuals coming into your project. If the name is not checkmarked, they will not be associated to the project entry. Again, check your provider, and in this case, the type will be HUD unless otherwise specified by the HMIS team. Also note that your entry date should match what you are in backdate mode to. If it does not, please get out of the screen by clicking the X and change it in the Backdate module section. From here, click Save and Continue. We are now taken to our EntryExit data screen. The first assessment you see will be the UDE Assessment. This stands for the Universal Data Elements. You will also notice the household members located to the left. Since it is highlighted blue, this means that we will now be completing the information for the head of household or the mother. The first question you will see is the relationship to head of household. In this case, since we are beginning with the head of household, we will select Self Head of Household. Next, we are prompted to complete the date of birth. The mother reports to have her date of birth as September 1st of 1972. Then you have the date of birth type as a full date of birth reported, approximate partial date of birth reported, client doesn't know, client refused, and data not collected. In the event that your client does not provide you with their full date of birth but tells you how old they are or the year that they were born, please use the approximate date partial date of birth reported and put the day and the month as 01/01 and then use the year reported. Again, in this case, she provided her full date of birth. Next, you will complete this client's primary race. You have American Indian or Alaska Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, white, client doesn't know, client refused, and data not collected. If you take your cursor and hover over the question, we do provide you with the definitions as provided by HUD. Keep in mind that HUD says if your client reports to be of Hispanic or Latino descent, their primary race is white. Their ethnicity is Hispanic Latino. In this case, our client reports to us that she is biracial of Black, and her secondary race would be listed as white, as she reported. Her ethnicity is non-Hispanic. Following that is your client's gender as to what they report to you as. We have female, male, transgender male to female, transgender female to male, does not identify as male, female, or transgender, client doesn't know, client refused, and data not collected. Our client reports to us to be a female. And then you have this question, does the client have a disabling condition? You have yes, no, client doesn't know, client refused, and data not collected. In this case, our client reports to us that she does have a disability currently recognized by HUD. If you take your cursor and hover over the question, it will give you the 7 disability types that are recognized within our continuum by HUD. Next, we have the question of residence prior to project entry. This question means, where did your client sleep the night before they checked into your project? In this case, we have homeless situations versus institutional situations versus transitional or permanent housing situations. If you have a question on the situation type and you are not sure how to describe it, please contact us at the HMIS Help Desk at hmissupport@cir.org. In this case, the mother reports to us that she has been on the streets for the past 3 years with her child. Therefore, her residence prior to project entry would be a place not meant for habitation. Then you have this question of length of stay and previous place. Please note we are asking, how long has your client been at the residence prior to project entry? You have the option of 1 night or less, 2 to 6 nights, 1 week or more but less than 1 month, 1 month or more but less than 90 days, 90 days or more but less than 1 year, 1 year or longer, client doesn't know, client refused, data not collected. Again, she tells us that she's been on the streets with her child for the past 3 years. So the answer to this question would be 1 year or longer. The question of approximate date homelessness started. When did the most current episode of homelessness begin? If she tells us that this has been a 3-year occurrence, this will most likely have began on July 1st of 2014. Then, regardless of where they stayed last night, the number of times the client has been on the streets, an emergency shelter, or a safe haven in the past 3 years, including today. Please note that a safe haven is a transitional living facility for individuals who are diagnosed as SMI as defined by HUD. You have the option of 1 time, 2 times, 3 times, 4 or more times, client doesn't know, client refused, and data not collected. Based off of what our client has described to us, she has been on the streets for the past 3 years consistently, so this will be 1 time. The total number of months homeless on the street, emergency shelter, or safe haven in the past 3 years is we are asking for the total number of months of homelessness experienced. And again, it's 3 years, so it will be more than 12 months. Please note that these questions are in reference to your client's history of homelessness, but it also helps determine whether or not your client is considered to be chronically homeless. So please be sure to appropriately document your client's history. If you are unsure or unaware of how to document or calculate your client's history of homelessness, please call the HMIS Help Desk and we would be happy to assist. The next question is the zip code of last permanent address. HUD would like to know where your client was last permanently housed for 90 days or more. By clicking your cursor right on top, we show you generic zip codes and cities and counties for the balance of state. If your client does not know the exact zip code but can tell you the city, county, or state, please use one of these listed. Then you have the question of the client location. There is only one option, so please choose it. From here, you can click Save. By clicking Save, you may see a change in the screen where you will see color bars. These are history bars. By hovering over it, it will tell you how old this answer specifically is. And by clicking on it, it can give you the history as to who answered the question and the values given. Once you've entered the information on the head of household, it is now time to enter the information on the child. To do so, click on the child's name located on the left side of the screen and answer the questions appropriately. Beginning with the relationship to the head of household, we will document that this is the head of household's child. This is also where you will list the child's date of birth, and this child was born on December of 2016. The child's mother did provide us with their full date of birth, so we will list it as a full date of birth reported. And complete the ethnicity and race and gender. Our client reports that her child is also biracial, of Black and white, and her ethnicity is non-Hispanic. The gender of this child was reported to us to be female, and the child does not have a disability. Please note that the only other question you have to answer for the child is the client location. The information around the child's history of homelessness is not required to be completed. So from here, you will click Save. You've completed the information on the child, and you click Save, click on the Head of Households profile, and then scroll up to complete the Universal Entry Assessment if it is not already populated for you. By clicking on this assessment, you will notice that the screen changes and you now are looking at the Universal Entry Assessment. The first part of this assessment is already completed as we completed it through the UDE Assessment. So then you will need to scroll down and complete the program data elements. At entry, you are required to report whether or not your client has a monthly income, if they are receiving non-cash benefits, they are covered by health insurance, and if they have a disability type or if they do not. We will begin with the total monthly income. At entry, our client reports that she is not receiving any income whatsoever. So the first box you will see is the total monthly income, and it is a text field box. We would like you to report the total income amount that your client may or may not be receiving each month. In this case, since our client is not receiving any income, we are going to click 0. Next, you will see the income from any source. You have yes, no, client doesn't know, client refused, and data not collected. Our client is not receiving income from any sources, so we will select this as no. Next, you must complete the HUD verification. To do so, you will click on the hyperlink and allow this box to appear. We will need you to verify that your client is not receiving any of these income source types as recognized by HUD. And since our client is not, we can use the blue button at the very top that says no to answer no for all questions and click Save and Exit. It takes you back to your screen and it gives you that green check mark to let you know that it has been completed. Below that, you have the information of the non-cash benefit from any source. Our client reports that she is also not receiving non-cash benefits, so we will select the answer as no. And then use the HUD verification to also confirm that our client is not receiving any of these income source types for non-cash benefits. You will then click no, save and exit. Then you have this question, covered by health insurance. Our client currently is not covered by health insurance, so you will click no. Then use the HUD verification to let the system know that your client does not receive any of these income source types. Please keep in mind that Arizona does not offer state health insurance for adults. Arizona offers Access. Access is Medicaid. Medicare is for senior citizens, and the state Children's Health Insurance Program are for children who are in DCS custody receiving the CMDP health insurance type. The Indian Health Services Program can be used for folks who are receiving tribal insurance. Again, our client is not receiving any of these health insurance types, so we will click no. And then click save and exit. The next part you will need to complete is the disabilities. If you remember, by scrolling up, our client did report to have a disability recognized by HUD. So, by going to the bottom of the screen and clicking on the HUD verification is where we will specify what that disability actually is. Our client reports to have a mental health problem. By doing that, we will click Yes for mental health, and this disability box will appear. The first part is the disability type, where it's specified as a mental health problem. The disability determination will now say yes, as it is self-reported. The next question is, if yes, is it expected to be of long and continued indefinite duration and substantially impairs ability to live independently? The answer to this question would be yes. And the question of, if yes, documentation of the disability and severity on file should only be answered if you have one of two types of documentation. One type you can accept is documentation by a licensed medical professional stating that this is a disability. And the second type you can accept is if your client is the recipient of disability monies by their government, you can take a copy of their reward letter. At this time, we don't have either of the two, so we will answer it no. These next two questions have path only written in parentheses. Please note that these two questions are only to be answered by the path team. If yes, currently receiving services or treatment, and the start date can be listed as the date it was reported to you, not necessarily the day that they have been diagnosed. Is the above condition going to be long-term? Yes, and you can skip where it says end date and click save. It will now take you back to that HUD verification disability screen. If your client doesn't report to have any other disability types, please use the button at the very top to click no to answer no for all other disability types. If your client has more than one disability reported, please, by all means, list each disability. From here, you can click Save and Exit, and it takes you back to the HUD verification screen. These next questions are continuum-wide questions, and we ask that you complete them. We have the domestic violence victim or survivor. In the event that your client is a DV victim or survivor, we would like you to answer either yes or no. If you answered yes, we would need to know when the experience occurred. And if yes, are they currently fleeing their DV situation and coming to you? We would also like to know, is your client currently in school or working on any degree? Has your client received vocational training in the past? And what's your client's highest level of education attained? In this case, she tells us that she did go to college but did not receive a degree. From here, you would need to click Save and then scroll up to go to the child. Once you're on the child's record, the only question you would need to answer through the Universal Entry Assessment is if they were covered by health insurance. And again, the mother reported that they are not, so you would click No, and use the HUD verification to click No. To answer no to all insurance types, click Save and Exit. From here, scroll to the bottom and click Save and Exit. And you have now successfully entered your client into your project along with their child. You can always verify by looking at the client count and clicking on that magnifying glass to the right of your screen to show you the clients that have been checked into your project and the date that they have entered. Now it is time to exit our clients from our project. From the screen, we will be sure that we are turning off our backdate mode, assuming that our client is exiting our project from present day. Through the EntryExit tab, you will click on the pencil to the left of the blank exit date. And then this is where you will check mark the names of the individuals who are exiting project together. Please verify that the exit date is listed correctly. And then list your client's reason for leaving. You have a completed program, criminal activity or violence, death, disagreement with rules or persons, left for housing opportunity before completing program, needs cannot be met, non-compliance with program, non-payment of rent, other, reach maximum time allowed, or unknown disappeared. In this case, we are going to state that our clients have completed our program, and then we must list the destination as to where they are going. Our client reports that they are going to be entering into a rapid rehousing project. That is specified as rental by client with other ongoing housing subsidy. Please note that this destination list is very similar to the residence prior to project entry with a few additions. If you are unsure of the destination type, please contact us at the help desk and we are more than willing to help explain. From here, you will click Save and Continue, and you will be defaulted to the client's Universal Exit Assessment. Through this, if your client does not have any changes to their income, the non-cash benefits, the health insurance, or the disability information, you will click Save and Exit. By doing so, it returns you to the screen and it lets you know that your client has an exit date. And again, to check the client count to make sure both clients have been exited, you will see the entry date and the exit date listed. Now, let's talk about a few key points. According to the BOS HMIS Data Quality Plan, you must enter clients into the system within 7 calendar days. The U.S. military veteran question is initially answered on the client search screen, but can also be answered on the client profile screen. When creating a household, you must go through the Households tab. And please note that there can only be one person designated as the head of household. When creating an entry into your project, you must go through the EntryExit tab. Also keep in mind the client demographic information should never be recorded on the client demographic section on the client profile tab. It should be always completed through the EntryExit tab. HUD considers the zip code of last permanent address to be 90 days or more. Also, remember these points when completing the length of time on the streets, an emergency shelter, or safe haven section for your client. When entering the date the client's current episode of homelessness started, you may use their current entry day into your project if they cannot remember the exact day. Count the number of times the client has been homeless in the past 3 years, even if they are not entering your project directly from the streets, emergency shelter, or safe haven. Next, add up the accumulated months of homelessness during the past 3 years where the client was either living on the streets, in an emergency shelter, or safe haven. Any single day or part of a month counts as one full month for this question. If a client enters with no income, please put a 0 in the total monthly income text field. In the state of Arizona, access is considered Medicaid. When creating an exit, be sure to go through the EntryExit tab and use the Edit Exit pencil icon to exit your family from your project. Please note that interim housing is not a type of housing, but rather a housing situation where a chronically homeless person has applied for permanent housing and has been accepted, or a unit and voucher for permanent housing has been reserved for them, but for which there is some other situation that prevents them from moving in immediately to housing. In such cases, where it has been determined to be absolutely necessary that to keep the client engaged and moving towards housing, a temporary solution must be utilized in transitional housing is used. The client should be identified upon move-in to the permanent house as coming from intern housing. If you have any questions about this, please contact us at the HMIS Help Desk at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you for joining us, and please refer back to your training confirmation email for further instructions.